hair transplant with only 1,500 grafts implanted. What are my options to fix the new 5 centimeter hairline? I'm 22 years old, male, with aggressive hair loss. I've been using Propecia since I was 17, but the hair loss has not stabilized. I got a transplant at a reputable clinic in the local area. 1,500 grafts were implanted. All the men in my family are Norwood 6. I was told that I could use 10,000 scalp grafts and 6,000 to 8,000 beard grafts. Since then, I've been told that this is not a viable option. Right now, my new hairline is at 5 centimeters. What are my choices? Was this ethical abuse?
Thank you for your question. You're 22 years old and you recently underwent 1,500 hair grafts in what appears to be the frontal hairline based on the photo you submitted, which was apparently a strip surgery, a FUT surgery. And you state that you've had hair loss since age 17, that you've been on finasteride since that time, which appears to not have stabilized your hair loss, that the men in your family are Norwood 6, and you were advised that you will need about 10,000 more grafts from your donor area, as well as maybe 6,000 to 8,000 from your beard, and now you're getting conflicting opinions, and you're now concerned on whether or not the procedure was done ethically. Well, I can certainly discuss a little bit about my strategy as it applies to patients like yourself who we see in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been a very big part of my practice. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we've developed to help men and women with genetic pattern loss using a non-surgical approach to help people with hair thinning that we've developed over the course of the past 7 years, which actually evolved from our desire to improve hair transplant surgery. So, I think that we're definitely dealing with a somewhat controversial area when it comes to transplantation in younger men. As far as my perspective is concerned, this is my perspective. And I don't think a lot of people have actually looked at patients this way, because I think that essentially the unfortunate reality of hair loss treatment as it is generally practiced is that if you go to a hair transplant center or clinic, you're essentially judged as to whether or not you're a good candidate for a transplant. But I would say that in the overwhelming majority, you aren't going to be someone who they will want to manage and take care of in the long term. It becomes more of a transactional approach. If you're a transplant candidate, they'll do a transplant. If you're not a transplant candidate, they'll tell you to go somewhere else. And then on the medical side, typically patients will go to dermatologists who will offer them basically finasteride and minoxidil. And then the rest is really limited. Essentially, what I've been looking at for many years is with this treatment called hair regeneration, which I'll explain briefly. It evolved out of our desire to help people with hair transplant. As you've probably learned from your own experience, that the donor area is a limited area. And the frustrations with hair transplant have to not only do with the limit, which is they can only transplant so many hairs from this donor area at one given time, but the survivability of the transplanted hair. So we used a material called Acellular matrix to help improve the survival and the viability of the transplanted hairs, as well as to improve the appearance of the donor scar. A fortunate side effect was that thinning hairs became thicker. Based on that observation, we've spent many years developing a process of injections in a way that can stop progression or at least significantly slow it down, prolong the growth cycles, thicken thinning hair, reactivate hair that's not growing. This has been a significant improvement in our approach to helping people with genetic pattern loss. Now, looking at a younger person, I would say in the category of younger males, I would say that by definition, by having a younger onset of hair loss, you fall into a more aggressive hair loss pattern. And I would even propose that there is, in terms of relative sensitivity to DHT or dihydrotestosterone, that men in your category are more sensitive to dihydrotestosterone. Now, you've been on finasteride and you feel it hasn't stabilized, but I would consider that in actuality that you are probably slowed down your progression by reducing the level of DHT. But unfortunately, the nature of your hair loss is such that the growth cycles are shorter. And therefore, even with the prolongation of and the benefit of a DHT blocker, your hair growth cycles are stopping earlier than before puberty and resulting in this more progression, which is different from your contemporaries. The question we have to always ask is, why is it that 80% of your contemporaries still have hair? Now, if you enter your 30s, your 40s, and beyond, the percentage will grow of male pattern hair loss. So it's been my observation that essentially there are two groups of men in their late teens to early 20s who develop hair loss. One group has a more highly aggressive and more advanced hair loss, which I think might be what's likely to be the category you fall in. And the other group has a early onset but moderate progression. They may have diffuse thinning. They may still hold on to hair longer and get into their 30s. They may still have significant hair loss, but it'll happen more slowly, as opposed to your category, which may lose hair a lot faster because of your early age of onset. With hair regeneration, we've been able to help people in your category prolong the growth cycles and get past several years and up to 5 years. But in differentiating the highly aggressive to the moderately aggressive, I would say the moderately aggressive tends to last longer with our injection treatment compared to the people who are very highly aggressive. And we, of course, discussed that in consultation. Now, as far as the options you have moving forward, I would say that you are almost stuck in a way because you've now taken that first step of doing a transplant. I would certainly expect that you would maximize or continue taking your finasteride on a regular basis. But I would say that you are, as far as future transplantations are concerned, depends a lot on how much more hair you lose and in what time frame. Generally speaking, from my training, from when I did facial plastic surgery and studied hair transplant, and for the decades to follow, it has been a general standard in our community to not operate on someone who is young because of their relative rate of progression and what is a desirable outcome and what is an acceptable outcome. You know, when we think of someone who comes in at their 40s and they want a hair transplant, well, they can handle having relatively smaller grouping of hair that can look appropriate for their age group. We've seen patients in our practice who are well into their 30s who have had 4 transplants, and the top of their scalp looks like they just barely have any hair, and they have very wispy hair. Now, there are options that exist beyond these numbers that are getting thrown around, especially when it comes to the beard hair option, is body hair transplantation. And although we don't currently offer that in our practice, I have seen very good results with that, and it might be a strategy that will help you maintain a certain amount of coverage as you get older. So certainly the question about ethics is still a question that it's not appropriate for me to give you an opinion on. Basically, it's from my perspective, it's not about ethics. It's about really what kind of results can I meaningfully deliver to my patients. So I think that it's critical that you get the maximum benefit of your current treatment strategy. And so there may be a value for you to consider something like hair regeneration to help enhance the benefits of the finasteride. And also I didn't mention is that we've also helped people who have gotten transplants, and we've been able to help improve the quality of their hair transplants as well. So learn more about these other options, and certainly if you discuss this concern you have with your surgeon, and hopefully your finasteride will continue to work. We've had histories from patients where they've said they lost a lot of hair in terms of their progression, and then they were stable for a while, and then they started losing again. So one can hope that that may be the case for you, so that you can go into your 30s without having significantly more loss. But it's very difficult to predict the future, and a lot of these patterns that I'm describing, young, highly aggressive, young, moderate progression, is based on actually reviewing the patient's history and looking at their scalps at different stages, as opposed to trying to predict from one point forward. But the early age of onset is certainly an aggressive pattern. So I hope that was helpful. I wish you the best of luck, and thank you for your question.